thank you all for coming this afternoon. I'm really glad to see you. This is our chance once a year to reflect on how we're doing as a school, how the last year has been, what we've done well, what we may be able to do better, and what we aim to do in the year that comes. As you know, I like to start off with a little bit of context setting, and I usually like to look outside the walls of the school to the world, the nation, our community. Just do a quick recap of some of the main public health events of the previous year. But I'm going to do that, but not quite yet, because I have something else to do by way of context setting, and that is to show you a picture. Now, you can't see this, but this is a gift that Chuck Tresser just gave to the school today at the founders' reception just a few minutes ago. This is an 1882 picture of milk inspectors finding adulterated milk, sampling it, and pouring it out onto the street after determining that it's adulterated. So this is 1882. It's from Harper's Magazine. Chuck tells me that this was just before his subscription to Harper's began. I want to thank you, Chuck, for the beautiful gift to the school, and I want to thank you for the reminder that our public health mission has been recognized for centuries and remains as vital today as it was in the 19th century. The recent story of melamine contaminating milk and food in China is a clear reminder of that. So thank you, Chuck. This will be here for everybody to have a look at after our session today. Well, it's been a very big year for public health. I think if you ask most people what was the biggest public health thing that happened this year, they would say Ebola. We saw the amazing explosion of that crisis, and then we finally saw it petering down to a very low level, which is a great thing. That has led to a lot of fascinating thinking over the ensuing months in the global health area. What do we need to do to build resilient health systems globally? What do we need to do to reform the WHO so that it functions better? What does the whole concept of global health security mean? A huge shot in the arm, if you will, to the field of global health, at least to the recognition among people around the world of the importance of global health. But that's not the only infectious disease that's been in the news. This is a picture of the recession of polio worldwide. This is the map that is still up on the CDC website. It goes through several months ago. And of course, what's happened since this map was last put up, you can see the reduction in countries from the 1980s to the present, is that polio has been officially declared gone in Nigeria. So we're down to just 2 countries. And the eradication of this disease actually looks and feels to be within reach, which is a fantastic piece of public health news. Big news on climate change this year. This is one of my favorite public health heroes of the year. This is, of course, Pope Francis, who issued his papal encyclical, Laudato Si', calling attention both to climate change and, inextricably linked with that, to the fact that social injustice has to be addressed if we're to address climate change. He made this a moral issue and an issue of distributive justice. Interestingly, the same week that this papal encyclical was released, the Lancet Commission on Climate Change issued its report calling attention to the health impacts of climate change, a real convergence of concern about this huge public health issue. And in the ensuing months, during this past summer, leading up to the Paris meetings on climate change, a lot of cause for hope. Both China and India, 2 very large countries, and the United States have all announced plans for reducing carbon emissions. One doesn't want to get too optimistic. We've been down this road before, but it does look as though the world is progressively getting to pay attention and developing mechanisms for controlling carbon emissions, which will be a huge public health bonus in coming years. Infectious diseases aren't the only global health problem. This is a just published accounting of global years lived with disability. But what I do want to call your attention to is that in the latest tally of global years lived with disability, you don't get to an infectious disease until the 25th item listed. It's diarrheal disease in children. So the enormous rise of non-communicable diseases around the world, paralleling and following an evolution that we saw in this country years ago, is a very important piece of public health news, and it's getting better and better documented. So in many parts of the world now, a burden of infectious disease alongside a burden of non-communicable disease, huge challenges for all of us in public health. And of course, this year saw the issuing of the Sustainable Development Goals. There used to be just a few Millennium Development Goals. Now there are many Sustainable Development Goals. Some people think that this looks like something that was written by committee, and it was in fact written by committee. Health is mentioned there, but so are lots of other things like clean water that have a huge bearing on health. So we expect and hope for a lot of momentum globally in addressing these Sustainable Development Goals. And interestingly, improving health in the context of a more sustainable world. We'll hear that echoed in just a minute when I remind you of the vision of our school. Here in the United States, what have been the big public health issues? Well, the continuing growth of income inequality. But what you can see here is that in the last few decades, the only segment of our society that has on average improved in its income is the upper class. The lower income people in the second column, the middle income people in the third column, you can see moving from 1983 at the bottom to 2013 at the top, have not seen real increases in income, large increases in income going to the upper income people. So this in turn has created a rising Gini index, rising inequality, and that we know is very bad for health. So a serious concern for us in public health. On the other hand, there is some good news. The Affordable Care Act has continued to be implemented. We're now beginning to see the research emerging. These papers that I'm showing you here are all from the last few months, documenting a reduction in uninsurance. I think we're down to about 6% uninsurance in Washington State, which is better than the national average. Improvements in access to health care for many populations that are especially vulnerable and have been underserved over time. So good news here for public health. Still lots of work to do in terms of health care access, improved quality, and lower costs. But we're in a good direction here. And here closer to home, both at the state level, the county level, and even here in the city, very exciting and encouraging things happening in the public health arena. The plan for the Healthier Washington that the governor's administration has issued, the Best Starts for Kids initiative that County Executive Dow Constantine has championed, and that will come to a voter initiative next year, and the housing affordability and livability agenda here in Seattle. We know very well that adequate housing is a prerequisite for good health, and our city has paid a lot of attention to this, doing a lot of work on addressing the shortage of affordable housing and the homelessness challenge in the city. So there is good work going on all around us, from the global level to the local level. That calls on us to redouble the work that we do at the School of Public Health and in the public health field, because all of what I just showed you, both the reasons for hope and the challenges that survive, all require what we bring to the table in public health. Our vision as a school is healthy people in sustainable communities, locally, nationally, and globally. Healthy people means both keeping people from getting sick in the first place and providing good health care when people get sick and need that health care. The community there calls to mind the importance of social networks and social context for people in maintaining good health. And the sustainable part there reminds us that there is a larger context for communities and for individuals, and that is the global ecosystems in which we live, which need to be maintained if we're all to be healthy. Our mission is the traditional three-part mission of service, research, and teaching, and this graphic from our strategic plan is a reminder that we don't see those as separate legs of a stool. In fact, they overlap with each other, and that's one of the things we're so proud about here at the school. So you may be doing research as a faculty member, but you're likely involving students in your research, teaching in the course of doing research. You may be providing service to the community, and that service may involve systematic collection and evaluation of data, which is like research. In fact, all of those three missions reinforce each other, and we're all about weaving them together here at the school. And the values that characterize our approach to public health and to our institution building here at the school, shown there on the right, are extraordinarily important. These are the values that we chose as a community when we did our strategic plan a few years ago. Every time I look at this list, I'm more convinced that we got it right, that these are values to live by. So let's go over some of the dimensions of our work, and I'm just going to take a look back at the past year. I'll flag things that have gone well, and I'll flag things that I think we need to pay attention to and maybe can do better as we go forward. First, welcome to our incoming students. We have a terrific crop of students coming in. The numbers are shown here. I'd especially call your attention to the 217 incoming undergraduate students who bring our undergraduate student body total up to just over 500. Undergraduates now represent 1/3 of our student body. We have a large number of MHA students, the Masters in Health Informatics and Health Information Management. The Masters in Public Health remains one of our biggest degrees, and of course the terminal degree for many people who go into public health practice, as well as a research credential for those who want to do clinical research. And almost 50 entering PhD students, bringing our PhD student census up to almost 300. Very large center for doctoral training, corresponding to our large research presence. Our students come from 38 states and from 17 different countries, so welcome to all of you who are new. That growing undergraduate presence is an important development to flag. This shows you the growth of our undergraduate student body. The largest portion there, which is purplish, is the public health major. And then the two other portions are the environmental health major and the health informatics major. All in all, a very large and excellent undergraduate student presence. In addition to the public health major, which has grown remarkably fast under the terrific leadership of Sarah McKenzie. Sarah, would you just raise your hand? A shout out for you and your team. And in addition to the two smaller undergraduate majors that I mentioned, we have undergraduate minors as well in nutrition and in global health. They weren't even counted on the numbers that I showed you, so this is a growing part of our academic presence here. The undergraduate major has had some real accomplishments this year. The brand new curriculum that it built while flying the plane is fully implemented this year for the first time. Faculty from all of our departments are engaged in undergraduate teaching, so that's really become part of our teaching portfolio here at the school. And as you can see in the bottom graphic, we were ranked by USA Today as the 7th best place in the country to get an undergraduate public health degree, which is really remarkable for a degree that didn't exist 5 years ago. So a real salute to the members of the undergraduate major team. A word about this ranking. It's USA Today. The methodology they use is completely opaque. And like all of these magazine and newspaper rankings, if you get a really good ranking, you crow about it. And if you get a bad ranking, you fuss about the methodology and say it doesn't mean much. I can't tell you that it is a solid methodology, but I'm sure glad to see us in the lights there. And it actually does recognize a truly excellent undergraduate public health major. One of the small developments this year, but very meaningful, is this. Who's heard of the Washington State Opportunity Scholarships? Anybody? Just a few of you. Some of the student hands are going up. This is a scholarship program established about 5-6 years ago. It supports undergraduate STEM students, science, technology, engineering, and math, around the state. When it was set up with a particular list of undergraduate majors that were eligible for WSOS scholarship support. And public health was not on it, environmental health was not on it, health informatics was not on it. Those absolutely are qualifying majors by the definitions of the WSOS program. Sarah and her team did amazing work for several years, beating on the door of the scholarship program to say, please list public health. This year, they finally did so. We already have 23 students getting WSOS scholarships. These are scholarships directed especially to low-income students, first-generation students, students from underrepresented backgrounds. So 23 doesn't sound like a very big number. It's about 5% of our undergraduate student body. And that's a terrific thing. We expect that number to grow with time as the students have more advance notice in the future during which to apply. So a lot of great news on the undergraduate front. Last year at this time, I showed you a slide just like this, showing a schematic of the changes to the MPH curriculum that our MPH task force had decided should be implemented. And I have to tell you that we've stalled on this. We did not get many of these changes made this year. So one of the things that I'll come back to at the end when I talk about priorities for the next year is to redouble our efforts. We have a very, very good MPH curriculum now. There is room for refreshing it and improving it, integrating subjects more effectively, and so on. And I think that will be one of the things that, although we didn't succeed this year, we will work hard to begin to put that in motion for the coming year. I want to give a shout out to all of the faculty members who have training grants. And the smallness and unreadability of the font there is testimony to how many of our faculty have put their time into writing training grants. This highlights the importance of student support. Education is getting more expensive. Students across higher education are finishing their education with debt, and we really would love to relieve the students of this and help support their education. It's a very important philanthropic goal for us. I want to salute all of the faculty who have written training grants that are supporting so many of our students. But as we look ahead, this rising tuition continues to be a real challenge for our students. We need more training grants. We need philanthropic support for our students, and those are priorities. Faculty are getting busier and busier. Faculty are teaching more. As I'll show you in just a minute, it's tougher than ever to get research grants. The faculty are really working hard, and what that has meant for some students is difficulty finding as much mentoring and advising as they'd like. So we do need to tackle this problem and think about ways that we can facilitate both for the faculty and the students that faculty-student contact that is so useful for both sides. And finally, the economic squeeze that we're still emerging from following the Great Recession has meant that with tuition flow not where we'd like it to be, with faculty salaries slowly increasing, the economics of small classes get more and more difficult. And so every one of our departments has taken a look at small classes. Some have moved to once every other year. Some have even been discontinued. We do need to maintain some small classes because they are so essential to the graduate student experience, but we need to think about sustainable business models so that we can keep those classes going while penciling out our budgets at the end of the day. So these are what I see as some of our teaching challenges moving forward. On the research side, I think everybody knows what the biggest challenge is. Research funding is getting tougher and tougher to get. The NIH budget has shrunk by about 25% in real dollars over the last decade, according to Francis Collins, the other Pope Francis. And there is more competition for funding than ever before. And the grants that are being given out are bigger than ever before, at least in the genetics arena. And what that means is that there is less money, or fewer grants are getting issued. So for all these reasons, we have actually seen a downturn in our grant funding over the last couple of years. You can see it here displayed in two ways. The first is the number of new awards in the upper panel, and the second is the number of dollars that we're spending per year in the lower panel. And that decline is important to note and important to tackle. We have an extraordinary powerhouse of a research faculty. We are a leading research institution, but we will need to get better at pulling in grants, and we can do that in several ways. Better research infrastructure for our faculty, bringing in terrific faculty who have new creative ideas for research grants and helping them to be successful, and supporting our existing faculty in doing their research. In fact, our existing faculty are doing terrific work at research, and although we have this downward trend that we need to reverse and will reverse, I do want to give a shout out to some of the faculty who are doing such great work now. This is a listing of our top 10 research awards for this year. What you can see is that some of them are quite big. They range across all 5 of our departments. They range from basic science to applied implementation science, if you will. They range across the range of diseases that plague humanity, from infectious diseases to non-communicable diseases. So a really impressive portfolio of research that I'm very proud of. This is a list of the new research awards that came in this year for the first time. You can see that they're smaller on average. Some of the big ones have been around for several years, and the ones that are coming in new are smaller. This reflects a national pattern. But once again, you'll see some of the younger faculty here who are bringing in the awards. You'll see a wide range of topics. And in many of these, if you look at who's on the research team, highly interdisciplinary teams from more than one department, and that is not only a great thing for collegiality in our school, but it's the secret to grant writing success these days. I'm going to show you a series of 6 slides now, and I just want to invite you to savor them as I come through them. These are some of the papers published by our faculty in the last few months, sometimes early this year, all of them this year. And what you'll see as you look at these is a phenomenal variety, ranging from basic science to applied research to program evaluation work, from methodology to very applied work. There isn't a single disease or condition you can think of, including upstream conditions such as war and crime and violence that our faculty aren't tackling and helping to shed light on with really interesting work. We're even seeing some interesting extensions of our faculty's work outside of public health. On the left-hand side, the middle paper there is an interesting piece of work that Bruce Weir did, taking his genetic analysis, applying it to elephants to help those conservation authorities who are trying to stop poaching recognize the origins of elephants and characterize the trade in poached elephants. So the work that we do here does a lot to improve the lives of people, both locally and globally. It also has real application to other sectors and arenas. We're seeing that in many parts of the statistical analytics that our school is so good at. And this is the last one of these that I'll show you. You may have seen yourself up here at some point. Nope. So moving from research to service. Service is the third part of our school's mission. It's a very important part of what we do. It's where we as a school make this community and this world a better place than it would be, but for our being here through active hands-on application of our public health work. Thanks to Tao Kwan-Get and the Northwest Center for Public Health Practice, we have this map, which is online now, which maps many of the service and community engagement activities that we undertake as a school. I invite you to go look at that. Here are some examples of our service activities this year. Supporting Best Starts for Kids, the county initiative on improved childhood services, health, education, and so on. Volunteering at the, what used to be called the Remote Area Medical. This is the Seattle-King County Clinic that just next week will go into its second year, setting up for several days down at Seattle Center, providing care to those who need it. Our students and our faculty are involved in providing that care and in evaluating the experience. And as you can see, some other programs, sometimes program evaluation, sometimes serving on committees, sometimes advising elected officials in how to make public health better. Jack Thompson, who is the president now for the second year of the Washington State Public Health Association, shared with me that the board composition of WSPHA, this is our state affiliate of the American Public Health Association, looks as though it's been invaded by the UW School of Public Health. All of the individuals listed here are board members. They either are part of our school community now or are alumni of our school or were trained here. So in terms of getting involved in carrying out public health in our state, our school has an enormous presence and makes major contributions. Thanks to Jack for sharing this information. Our undergraduates, who are a growing population at our school, are also a growing contribution to the service activities of the school. There is no way in the world you should try to read this. But if you could read it, what you would see is that about 17,000 hours of service work were contributed by the undergraduates alone this year in an astonishing variety of settings around our community. That's great for their education, it's great for the beneficiaries in our community, and it's great for this university because it helps advance the profile of this university as an asset to our community, something that is very important and consistent with our goals. In fact, when we do things like that, it helps bring notice to the work that we do because these things get covered in the news. I really like watching coverage of our school in the news. Thanks a lot to Catherine Chen and the communications staff for tracking this as carefully as they do. We have a lot of mentions in the news. Sometimes it'll be because one of our faculty members does a piece of research and that piece of research gets covered. Sometimes it'll be because somebody else does a piece of research somewhere else, but one of our expert faculty gets called by the media and asked to comment. And that can happen nationally as well as locally, and it happens quite often. Sometimes we're in the news because one of our faculty members takes the initiative to write an op-ed piece or a letter to the editor regarding an area of expertise, essentially bringing public health insights and knowledge to the public. And this is a terrific service. The last one listed here is an example, Health Benefits of Addressing Climate Change, a Newsweek op-ed that Chris Ebi co-authored earlier this year. I have enormous respect and gratitude for those faculty members who go ahead and kind of step off the process of writing academic papers and use your expertise to help enlighten public dialogue about public health. I want to turn for a couple of minutes to diversity, an extraordinarily important goal for us as a school and something that we need to do better at than we've done. Now, we've done some terrific work, and I salute the diversity committee at the school, led by India and Hitana, who I just saw India here. There you are. Hitana, are you here? So, terrific committee, faculty, staff, and students. They've taken a lot of initiative this year. In terms of curriculum, they surveyed our curriculum together with the curriculum committee to identify what we're doing and what we could do better. They got very involved in student recruitment and retention, looking at the application process, actively reaching out to students to encourage applications to the school. They've worked on the climate at the school, one of the important elements of achieving better diversity in higher education, by offering Undoing Institutional Racism workshops for faculty, staff, and students. They have worked hard at diversifying the faculty, both at the level of recruitment by developing best practices and bringing those best practices to each faculty search committee we stand up, and at the level of retention. And across the university, we have some important efforts going on, both the Center for Equity, Diversity, and Inclusion, which began as a medical school center and is now being enlarged to cover all of the health sciences. Our people are very involved in that growth. And the Latino Center for Health, another new initiative this year that got state funding, and our people are very involved in that. And finally, orienting our new chairs on diversity procedures and practices here. So very, very good work by this committee. But we are still not as diverse a community as we could be and should be. We need to be as diverse as possible because the publics that we serve are extremely diverse and getting more diverse. So this needs to be at the center of our goals. The Diversity Committee has planned a set of activities for this coming year. And I'm very pleased to see that a group of faculty have taken initiative to call this out as an unmet goal and have come together with energy and with suggestions and will be joining in this work in the coming year so that I think we'll be able to move more towards success than we've ever been before. Many of the efforts that you see here, I won't read the slide to you, but they are extensions of the foundations that were laid down this year by the Diversity Committee, and I think will lead us to a number of very important steps forward. So for me, this is a very high priority. I hope that it is for all of you as well. This is something that we need to be working on relentlessly. We have a lot of accomplishments to celebrate, and I like to do that at this meeting. The problem is there are so many accomplishments that if I recited them all to you, you would probably fall asleep. So I'm going to move through these fast. I won't read them to you, but I'll leave them up there and invite you to gaze down each slide. A number of very notable faculty accomplishments, many of them within the subspecialty fields in which the faculty work. So the professional associations in various fields such as epidemiology have recognized excellence in our faculty and have awarded it or recognized it this year. And I am very proud of all of these faculty who are listed here. Our students are also terrific. Heather Fowler is a student whom you saw in the video. She is a remarkable student, a veterinarian with an MPH who's now getting her PhD in environmental and occupational health. While she's doing all of that, she's one of the most amazing systems thinkers I know, and she's providing volunteer care for animals in need while doing her PhD. So whatever award she gets, it's not enough. But a lot of our students are terrific as well. You can see some of them listed here. And we're very proud of the work that our students do. I'm just going to say a word about finances. This is a high-level state of the school address, and I don't want to get us bogged down too much in finances, but I do want to report on some important trends that are essential to understanding our school's trajectory. And this is the picture that will show it. So this takes us from 2013 up to 2016, and it shows some trends that are now unfolding as we come out of the Great Recession. If you look at the blue band, that is ICR. Let me put this in perspective, actually. You'll see that the total here is about $20 million. This represents about 10% of our school's operating budget. The rest comes from grants and contracts, the large portion that isn't shown here. There's a revenue stream that goes to the Department of Environmental and Occupational Health Sciences from the State Department of Labor and Industries, not shown here. That's a constant revenue stream to that department. What's shown here is the money that is dispersed by the university to our school, and it's the money that's relatively flexible for us. The grant funds that flow directly to the investigators support the grant activity for which they're allocated. This is the money that we have to work with, to build, to invest, to pay our faculty some base salaries and to pay our staff. And what you see here is the blue, the ICR has decreased more than $1 million in the last few years. That's indirect cost returns. That's what we get in addition to the research that we do, and that parallels the decline in research funding over the last few years. The orange band is undergraduate tuition, and what you can see is that it has increased more than the ICR has decreased. So there's a rebalancing here, and this very rebalancing is happening in most of the benchmark schools of public health around the country. Everybody's seeing a slight downturn in research and turning more toward teaching. What that means is that our two missions of education and research remain very strong, but in slightly different proportion to each other than they've been. And what that means for individual faculty members is that many of them are spending a bit more of their time on teaching and a bit less on research than they have traditionally done. The green bar is graduate tuition. That's about stable, as our graduate student body has been about stable, but most departments are looking at a little bit of expansion in coming years, so we may see that increase. And the yellow bar is the provost supplement. That's provost discretionary funding to the school, and that has been stable over the last few years. So this is our financial picture. We have blunted the impact of the declining research with our increasing teaching. And my intention for the next few years is that that research band will increase as we redouble our efforts to bring in research grants and as some of our very energetic new faculty become successful at bringing in grants. I want to welcome some of the new faces who are here. We have a lot of new faces this year, and what I'd like to do is ask each person who possesses one of these new faces to stand up as your name is called. Afshin, Jed, Tanya, Sarah. Sarah's actually not a new face. Sarah moved from staff to faculty. Joe and Paul. And I actually had in mind standing up and staying standing, but clearly you don't want to, so that's okay. Paul, Anne-Marie, Brandon, Anjum, Simon, and Jeremy. You are all here. This is wonderful. Welcome to each of you. Scott, Geeta, Sarah. Sarah Lindstrom won't be here until January, so wherever you are, Sarah, please stand up. Cynthia, Elaine, and Kurt. And Patricia, Nancy, Jeff, David, Edwin, and Suzanne. So this is our new faculty cadre. Welcome to each and every one of you. This is when I get to say, congregation, be seated. We have a new member of our Office of the Dean Leadership, Uli Haller. Uli, would you stand up and wave to everybody? Uli is our Senior Director of Finance and Administration. He is incredibly skilled and experienced at the management of complex institutions, both on the people side and on the fiscal side, and has been a terrific addition to our office. And we've had some turnover in the OD staff, giving us no fewer than 7 new members. I think many of them are here. Marcus, Stacy, Savannah, Melissa, Janae, Libby, and Vicky. Any of you here? Hey, Savannah. So the Dean's Office is meant to be as transparent as possible and to serve you as well as we can. There is a really nice organizational chart on the Dean's Office website, and if you care to take a look at that, you'll see how everybody fits in. We've got about 5 core functions in the Dean's Office, ranging from advancement to communications to HR to finance, and a terrific team working in all of those areas to serve you and help make the school work as well as it can. I'm really pleased to announce that we have 2 new chairs in this school this year, and they are both here. Jeff Harris became the chair of the Department of Health Services following a very good run by Larry Kessler. Welcome, Jeff. And that's better. And Victoria Holt became the chair of epidemiology following no fewer than 15 years of terrific service by Scott Davis. And I don't want to crow too much about this, but I do want to say that in the 45 years of our school's life, there had never before been any female department chairs here, and we now have 2 out of our 5 department chairs as women, and that is looking like it ought to look. Okay, now for the strategic discussion, and then we'll wrap up and we'll go into some dialogue. This is our strategic plan. We do have a plan. We are very strategic as a school in moving forward in all of the elements of our mission, and I want to review those pieces with you a little bit and take stock of where we are. You may remember that our strategic plan that we adopted about 4 years ago, has two major parts to it. The first is called strengthening our core, and that really means operating more effectively as a school. Strengthening our core functions that have made us as good as we are. And the second is meeting emerging challenges. So that was the new and innovative part of the strategic plan. Not that there's no innovation in strengthening our core. We can do the things we do better through innovation. But this is more operational. The emerging challenges are more over the horizon aspirational challenges. So these are the 7 areas that we identified in strengthening our core. What we've tended to do every year is identify the pieces of these that we want to work on that year. Under each of these, there are several goals for a total of several dozen goals as part of our strategic plan. We've known all along that we can never tackle them all at once, bandwidth and staffing and time being limited, so we pick the top priorities for each year. Last year, these were the ones that we picked. My assessment of each of them is shown here. In several of the areas, such as broaden opportunities for public health training, we made major steps forward. It's not that we're done, but we can be proud of what we did, expanding several programs. The health informatics program, for example, has expanded considerably and has a new cadre of students in it. So we are continually upgrading and updating the reach of our educational programs. Strengthening the delivery of high-quality education across our degrees, I gave that a mixed score. We did terrific work at the undergraduate level, but a yellow light only partially met when it comes to the MPH curriculum. We had done a lot of design work and didn't manage to move that forward this year. The curriculum committee and our office and faculty leaders will play a big role in moving that forward in the months to come. We identified developing mechanisms to facilitate cross-disciplinary research as a goal. A lot of that in practical terms means working out financial agreements, MOUs, with our collaborators so that the research can proceed seamlessly and so that the ICR gets divided fairly. In an age of activities-based budgeting, people are paying attention to every dollar, and it's important to have those agreements in place. We have many of those agreements in place now, and things are moving relatively smoothly. The strengthening connections between research programs and the needs of communities and practitioners, this really was a plug for community-based research, for a research agenda that is grounded in community needs. We have a lot of that research going on already. I'm not sure that we made major strides or progress in that goal, and so I've given that a yellow light. If I need to be corrected on that, I'd be happy to be corrected. Diversify the school's faculty and staff. Mixed results, very, very good work by our diversity committee, but the profile of diversity in our school still needs work, so I'm giving that mixed score. And building support externally, we've done very strong work in terms of fundraising this year. Our advancement staff, led by Megan Ingram, who is here somewhere, there she is, has been very much collaborating with the Upper Campus Advancement Office, preparing for the rollout of the university's big campaign, and I think we're in very good shape there. With regard to meeting emerging challenges, you might remember that there were 6 of those. They're shown here. They have rather unexciting symbolic representations here, and I'm going to show you an improvement on that in just a minute. But the main approach that we took to these emerging challenges was to initiate faculty hiring so that we could bring in leaders who could then consolidate a lot of the foundational pieces that are in place here and get us to the next level of research, teaching, and service in each of these areas. In each of these, we thought we had a very strong foundation to work with, and in fact, we do. Well, I'll come back to those in just a minute. When we came down to planning for this year, we held a summit this past summer. The SPHEC, the department chairs, a number of the committee chairs, the curriculum committee, other school leaders, and asked some fundamental questions. How are we doing with our strategic plan? Not only what will be our priorities for the coming year, but big picture, how are we doing as a school? This is a moment to pause, several years into our strategic plan and ask whether we need to make any major changes. We did some very probing discussion both before and during the summit. Some of the realities that we reckoned with are the ones that are shown here, the declining research funding that I've alluded to already, the fact that some of the major research programs that have been pillars of our school for decades in some cases are reaching the ends of their lifespans, the declining state support for higher education, the fact that we have more competition in the education space now than we ever have. As recently as when I got here 5 years ago, we used to say we are the only school of public health west of whatever it was, Minneapolis, and north of Denver, I guess. But that's not true. There are lots of options for students to get their public health training right in our region now, and so that changes the landscape for us. We have a quite large faculty at our school relative to that little $4 million stream of provost discretionary funding that I showed you. The amount of funds provided by the university to other schools is higher on a per faculty basis than ours is. We are a highly decentralized school. There's lots of historical reasons for that, but that is a very important operational feature of our school. And at a time when funds are scarce, one wants to look hard for inefficiencies, and that may be an inefficiency. Many faculty are approaching retirement in our school. That reflects kind of a cohort effect. We had a large growth of our faculty in the 70s and 80s, and that faculty is now approaching retirement. We use ABB allocation within the school. We're the only school at UW that does that, and that has both positive and negative aspects. And our space is not adequate. I don't have to tell you all that. So these were some of the realities that we laid out in doing our situational assessment. Then we asked some questions. How big should we be? If, for example, we see that our state funding stream is relatively small when adjusted for the number of our faculty members, should we have a smaller faculty? That would mean more funding for each faculty member, but it would completely change the reach of what we do. How should we approach tenure at a time when ABB is the funding mechanism for the university? Our departments vary quite a bit in how they use tenure, and that was a topic that merited discussion as well. Should we retain the funding mechanisms that we use within the school, or should we change them? How much decentralization is okay, or should we think about consolidating some of our school functions, the pre-award, the post-award, the travel, the purchasing, the admissions, whatever? How do we increase philanthropic giving? Extremely important to change that part of the mix of our funding. It's a relatively small stream now, and we need it to be bigger. We think that's a big opportunity in our region. How do we engage our community? You recall that was a goal for last year, and that remains an important concern now. And how should we maintain, or should we maintain those 6 emerging challenge priorities, or do they need to be changed? So these were all of the things we discussed. You can imagine that it was a wide-ranging and probing discussion. We had a facilitator. We did some mapping using a sort of a standard facilitation approach, and I won't take you through this map, but what you can see is that the cells that are in blue and in red font were the ones that the group at the summit identified as priorities for the coming year. So this went a little bit beyond just revisiting the list of our strengthening our core priorities and identified operational goals that we have as a school. One of those pertained to the emerging challenge areas, and the general sense of the group was we still like those 6. In fact, we haven't fully had the chance for them to show what they can do because we haven't fully implemented most of them. And I'll get back to that in just a second. In the meantime, we came out of the summit forming working groups. The working groups are listed here with the project leader shown and pictured there. You can see that Shirley Beresford, the Senior Associate Dean, will be working on revisiting the emerging challenges, seeing if any of those need to be tweaked or adjusted or maybe even replaced. The administrative efficiency infrastructure will be led by Joe Gallagher, and I'm really pleased that one of the leaders of our staff at the school has stepped up to help with that. Revenue generation, Uli is the named project leader, but that is, of course, very much an advancement task as well, so he'll be working with Megan and her team on that. We need to increase the size of the pie that we have. Over on the right, the middle box says strategic investments. That has to do with using the pie that we have as well as we can. So how do we invest money within the school? How do we spend our money to get the biggest bang for the buck, to support the faculty, to support our students, to get our work done as effectively as we can. And Uli will be leading that as well. On the bottom right is leadership effectiveness, and Adrian Heidi will be leading that. There was a sense that all of us, from my level to the department level to the student level, would benefit from leadership training, something that many of us in public health don't get much of. And it's not that intuitive to some people, so we're going to be very thoughtful and intentional about that this year. And the box on the upper right is picking up the MPH curriculum refresh that I mentioned we need to redouble our efforts at this year. We do not have a designated hitter for that yet. The curriculum committee will be very involved in that, but we will identify one leader in the near future as well. So these will be priorities for the coming year. With regard to meeting emerging challenges, one of the things that I've been thinking about is how to reframe these in a more compelling way in the context of the university's campaign and the fact that we need to attract philanthropic money. If you simply utter a phrase to a donor like global environmental change and health, then you may not attract much excitement from the donor. But if you present the opportunity to solve major problems, and if you have more exciting visual icons, then you begin to frame a campaign to help raise funds to support these emerging challenges. We also are moving ahead with hiring faculty in each of these areas. So I'm very pleased to note that in the first of those areas, the understand and protect people from the hazards of global environmental change, Chris Ebi joined the faculty and Jeremy Hess has joined the faculty. They're both here. And this is a very, very strong critical mass in this area. They're already working with colleagues at the College of the Environment and other parts of the university and externally to advance that agenda. In each of the other areas, there is a search underway now, and we actually have offers out in a couple of them. So I expect to be able to say next year at this time that we have really impressive faculty on board in most, if not all, of these areas. And we'll see program growth in these areas across the school. So I'm going to wrap up now, but before I summarize how I think we're doing, I just want to ask your indulgence and get personal for a minute. I've had a couple of milestones in the last month. One is that I hit my 5-year mark here as the dean of the school, and the other is that I, as my wife says, I got to my halfway to 120-year-old point, hit 60. And as you can imagine, hitting milestones like that makes a person a little bit reflective. And so I've been reflecting and wanted to share a couple of reflections with you. The main way I feel in thinking about those two milestones is grateful. I am truly grateful. I'm grateful for the chance to do meaningful work. I'm grateful for the chance to work with all of you. I'm grateful that we are together a mission-driven, collegial, resourceful community. We take care of each other. There isn't a person here I don't enjoy seeing. There isn't a day that goes by when I don't enjoy coming into work. I love this institution, and I truly am grateful. And I hope that all of you can say the same. It's a special time to stand back and think about where you are in life and realize how lucky you are. The second reflection comes from Ron Sims, who is a good friend and the chair of our Dean's Council for the school, who gave me a toast at a birthday party, and he said, you know, 60 may feel like you're getting old, but actually 60 is when your really good work begins. And Ron has passed this milestone. He didn't tell me how long ago, but it's a while ago. And he said, you know, you're unfettered, you're energized, you have a clear sense of where you want to go, and this is when the good work really starts. I kind of feel that way too. I feel energized and looking forward to what's to come. And the third piece isn't really a reflection, but it's just an informational notice. At the end of 5 years of being a dean here at University of Washington, deans get reviewed. So this is my year to get reviewed. Many of you are on the review committee, which will be starting its work pretty soon, and I thank you for serving on that committee. All the rest of you will have the chance to comment. Now, I always welcome comments. I love hearing from you and love learning about how I can do my job better. So that's always welcome. But now there's going to be an official, I think, anonymous website. So if you didn't want to tell me how I can do better before, now it's going to be easier than ever. But I do encourage everybody to participate in that. I really welcome the feedback, and as grateful as I am to have had this wonderful 5 years as your dean, I am eager to learn what I could do better, learn what went well, and help all of us as a community move the school forward to even better and better places. I think these are dynamic and challenging times, and the combination of the scarcity of grant funding, the competition in the educational space, and so on, make it so. But our mission is more important than ever, and if you can't feel inspired and invigorated by looking at that set of developments globally to locally, I'd be very surprised. Our fundamentals are very strong, a really excellent faculty, really excellent students, a superb and dedicated staff, a great location, expertise in a lot of the key areas that the world needs, a good track record, a stellar reputation. We are a really strong institution. We've rebalanced our research and teaching, and that is an important trend to call out. It doesn't change our fundamental nature, but it changes the balance of how we build our portfolio. We have identified key strategic priorities. They all seem to be sound year after year. They won't last forever, but for now they seem to be good priorities for us to stick with and to implement step by step as we're doing. We are acting on these priorities, and I'm really pleased at our progress. We haven't done everything we set out to do. That's probably more than we can hope for, but we've done an awful lot. And we are changing the world as we do those things. Thank you very much for coming today. Thank you for the good work you do in advancing public health, and we're open for discussion.